Hello guys, today we are here to have a revision on emergency neurosurgery. First is the revised trauma score. Revised trauma score is asked many times in MCQ in NEET PG and NEET SS. You have to just remember the components of the revised trauma score. That is, number 1 is the Glasgow Coma Scale GCS, number 2 is the systolic blood pressure, number 3 is the respiratory rate. This is the three components of the revised trauma score. Then we will see the assessment flow chart. Assessment flow chart, I have telling you this because first, when a patient comes to you in trauma, first you will assess the airway, breathing and circulation, then you will go for the primary survey. When you go for the primary survey, you remember the GCS and the extremity movement is a component of the primary survey, not the secondary survey, many times asked in NEET SS. And the component of secondary survey includes scans and imaging also. Just remember this. These are the assessment flowchart. The next thing that we are going to see is GCS, that is Glasgow Coma Scale. Glasgow Coma Scale have three components. One is eye opening, second is verbal, and third is motor. The maximum GCS score is 15 and minimum GCS score is 3. In eye opening, we give maximum of 4 point. In verbal response, we give maximum of 5 point. In motor response, we give maximum of 6 point. Starting with the eye opening, if there is no eye opening at all present, that is score is given is 1, that is none. If is eye opening to pressure or pain, that is given of score of 2. When we calls the patient's name and the patient opens his eye, then we give the score of 3. And when there is a spontaneous eye opening, then we give the score of 4. Then we have the verbal response. If there is no response present, then we give the score of 1. If there is inappropriate sound like ah, oo, these are inappropriate sounds, then we give the score of 2. If there are inappropriate words means if I ask the patient what is your name, but the patient says car, bus, then it is irrelevant to the question I have asked. So it is known as inappropriate words. We give the score of 3. And when the patient is confused, means I ask the question, patient understands the question and answers the question, but patient is not oriented to time, place and person. Therefore, we give the score of 4. And when the patient is oriented to time, place and person, we give the score of 5. Now motor response. Motor response, if there is no response, then we give the score of 1. If there is extension means decerebrate posture. Okay. And abnormal flexion means decorticate.
Subscribe for
Remember
part
like
2.
this, decerebrate, this is the brain and this is